Okay, Foster here. We're going to try to do a secondary survey of ATLS now. Got to get ample history, allergies, medications, past medical history, last meal, and events. You can ask them really quick. Events is like, what happened to this? You're hiking 3 days in the desert, or was he intoxicated and jumped? Head to toe physical detailed examination. Frequent reassessment of the vitals. And diagnostic studies like CTs, exams, and stuff like that. Couple things for HENT. Look for battle sign, raccoon eyes. Hemotympanum is on that right lower. Seatbelt sign. Diagnostic aids, CTs, x-rays, blood work. You really want the patient stable before you go to radiology. This is a simple pneumothorax. There's no real tension. Talk about tension pneumothorax. You got to fix immediately. Here's some pictures of tension pneumothorax. You can Google it. This has to be treated quickly. You need emergent needle decompression, second intercostal space, mid-clavicular line. Here's a hemopneumothorax. Here's a widened mediastinum, usually from a decelerating injury. You worry about a aortic rupture. He's also got a chest tube on the right. Here's a bad pelvis, shattered. You really like an ATLS. We like a one-view chest and a one-view pelvis just for this reason. You can bleed through your pelvic veins and they can actually lose a lot of blood. Epidural hematoma, it's kind of egg-shaped. There's a skull fracture. Subdural kind of bleeds through under the dura. Talk about abdominal trauma. Mechanism, fast exam could be a nice early screening tool to see if you're bleeding. Always think, hypotension, tachycardic. Look for your abdominal exam. Here's seatbelt sign. Here's descension, ecchymosis. Splenic injury, here's a picture of a spleen down there on the right. That's bleeding. Liver injury. This is the stomach. It's a diaphragmatic rupture. The stomach's way too high. Here's the diaphragm. Oops, it's way up there. It's a diaphragmatic rupture. Hollow viscous injury, talks about free fluid. Blood abdominal trauma, here's a bowel injury. CT scan, fast exam, kind of want 4 quick views, cardiac, right upper and lower quadrant, and suprapubic. Looking for free fluid, basically. Always remember this stuff. We can't beat it enough. Multiple hospital visits, trauma, drama, high suspicion's key. Dispo, of course, in our place, we want everybody admitted to the trauma services, then consult everybody else. So trauma services has to be consulted or admitted in our traumas. And it makes good sense. They do secondary and tertiary exams, and it's what you'd want. So trauma team's aboard with it. Remember, trauma is a team approach. It's not one each person. We really want to do the primary and secondary surveys as quick as we can. Once we see a life-threatening injury, we should do an intervention right then and there and fix it, then move on.